Good morning and welcome. Thanks for joining us for House Calls, Real Docs, Real Talk. I'm your host, Mercedes Fuller, back to get you right on track for better health. Today, we're talking tobacco and more specifically what the American Heart Association refers to as the tobacco endgame. Just as the title suggests, the AHA envisions a future without tobacco and without vaping. And we've created an aggressive approach to make this vision a reality. So this morning, we'll be answering all your questions because we've called the right doc to help us out with this. Let's get started with the conversation. With me this morning is Dr. Esa Davis, Associate Professor of Medicine and Director of the UPMC Tobacco Treatment Service. She is also a board member of the American Heart Association, and she's with the Pittsburgh affiliate. Dr. Davis, welcome.
Thank you. Thank you. It's so great to see you, and I'm very excited to be here.
Absolutely. We're excited to have you here. Let's start our show with my favorite segment. We call it Health in the Headlines. You've heard me say it before, good health is always newsworthy. So each week we select a current headline that ties back to our topic at hand, and then we ask our expert to share their thoughts. This week's entry comes to us from the Los Angeles Times. It reads, "Addicted to menthol, big tobacco's targeting of Black communities could soon end." Dr. Davis, what do you make of this, and is this progress?
Yes, this is actually great news, long overdue. I think, yes, we are making progress. Anytime we can decrease the access of these harmful products, prevent the use by especially young people is progress. And every person we can get to quit is progress. And anytime we can reduce and eliminate health disparities is progress.
Absolutely. Absolutely. Let's get to the heart of our show with your viewer questions in You Ask, We Answer. Dr. Davis, there are a lot of questions that have come in, so let's get right to it. Our first question comes to us from Viola in Knoxville, Tennessee. Viola's question echoes the headline that we just read from the Los Angeles Times. And we recently spoke about the FDA, and they announced that they will start a rulemaking process to ban the sale of menthol cigarettes. Why has this challenge taken so long to remove the menthol cigarettes from the market, and what impact would it make if the FDA is successful?
Yeah, that's a great question. And honestly, I think we all don't really know why it has taken so long. It's like I said, it's long overdue. There was a prior petition to the FDA in 2013 to remove menthol by many health organizations that kind of brought that forward. But it doesn't seem to have made much of a difference until now, when they were faced with a lawsuit from the African American Tobacco Control Leadership Council, along with other supporting groups such as the AMA, where they really began to say, okay, we're going to do this. Let's start the rulemaking process. So, but I'm glad that they did. I think it is tremendously important because it will help us limit the number of young people who will start. Oftentimes, young people will start using particularly menthol. Certainly the targeting of vulnerable populations such as the Black and Brown communities, as well as the LGBTQIA community. So I think this is progress, long overdue. And it is exciting to see that they're starting to move forward with this.
Absolutely. Absolutely. So exciting to see that they're moving forward. Kimberly from Sioux City asked the question, the tobacco endgame paper calls for governments to remove all youth appealing and other non-tobacco characterizing flavors from all tobacco products. Why is removing flavored products so important?
Yeah, absolutely. So I think it's because we, as you know, remember when you're children, they taste good, right? And so they're appealing, particularly to the younger group, because smoking tobacco in and of itself doesn't taste good, right? So the way that you kind of get them hooked on it is by all of these flavorings that make smoking appealing, because it kind of dampens the quote unquote nasty taste of tobacco. And so, removing those flavorings hopefully will make these things less desirable, particularly for the younger population, and prevent them from, starting this addiction by getting hooked. So it's really important.
Absolutely. Absolutely. Here's one from Keisha in Lake Tahoe. Making traditional cigarettes less addictive by limiting the amount of nicotine is one of the recommendations in the Tobacco Endgame paper. Your research includes studying the level of nicotine in cigarettes. What are you finding about the potential impact of nicotine reduction, and what would this reduction cause? What impact would it have?
Certainly. So I'm going to answer this question in two ways. So the first is there is a part of addressing tobacco is by a harm reduction approach, and so the low nicotine, the exploring the low nicotine cigarettes is a way to reduce harm for people who are smoking tobacco. So we did a randomized control trial where we looked at very low nicotine cigarettes. Giving one group very low nicotine cigarettes, and then also giving the second group very low nicotine cigarettes plus the nicotine patch to see which one would be more helpful in reducing the number of cigarettes that they smoke. Both groups do that. So very low nicotine cigarettes do decrease the number of cigarettes people will smoke, which is a good thing. And so in that regards, the research is showing that it can be helpful in getting people to eventually get off cigarettes. The other, and let me just preface it by saying that is looking at an adult population, and usually in an adult population that is a moderate to heavy tobacco user, in looking at this option as a way to help get patients to quit smoking. But when we're talking about children, we're talking about very low nicotine cigarettes to maybe decrease their whole desire to continue with smoking, right? So it makes them less addicting, and hopefully can kind of break not even get them started on a lifelong of addiction with tobacco. So.
Absolutely. Absolutely. How about this one from Albert? He's asking us, what are some of the biggest concerns around e-cigarettes, and what concerns you the most, doctor?
Yes. So e-cigarettes is tricky, because we're really talking about two groups again when we're talking about e-cigarettes. We're talking about adults who are tobacco users, and many of those adults using it as a quit aid to quit smoking. Currently, it is not a FDA approved quit aid, even though people are using it as such, because we do not know the long-term health risk of being on e-cigarettes. They're not, currently approved for the use of a quit aid. So that's one. The research does show, the limited research that has been done does show that it can decrease the risk of using cigarettes. But again, most people will switch over to e-cigarettes, and then it's almost like substituting one addiction for another, because now they're on e-cigarettes, and we do not know, again, the safety of using them as a quit aid or the long-term benefits of continuing use. With regards to children, we don't support it at all. E-cigarettes are often used as a gateway to start a tobacco addiction for children and young adults. And so they often see these products as a safe alternative to tobacco, which is certainly not true. nicotine is a very addictive substance. It has harmful effects on the developing brain of children and young adults. And so we strongly, recommend against their use, and also work very hard to decrease this perception that they're safe. And oftentimes, again, they're used as a gateway to starting tobacco use, which then ends up being, an obviously bigger problem that they carry into adulthood. So.
Absolutely. And we thank you for clearing up so many misconceptions around the e-cigarettes. Dr. Davis, we're going to take a quick break and listen to a testimonial from Will. He's a teenage smoker. His perspective is really important to consider since the tobacco industry increasingly targets the youth market.
I'm Will. I'm a senior in high school right now, 17. I was 14 when I started vaping. I had smoked cigarettes before for a while. So when they were like, hey, it's the same thing, it's just safer, it's fine, it's like water vapor, there's less nicotine, none of those things are true. So I tried it, and the first thing you notice is how much smoother it feels. It doesn't feel as dangerous as a cigarette does. I think it's often overlooked how much a part mental health plays in addiction. I'm diagnosed with depression and anxiety, and it's been a really difficult thing in my life. So when I was introduced to nicotine, it was like, hey, it's this chemical that makes you feel better. When I first started, I was a cross-country runner and cross-country skier, but my lung capacity was never the same. It felt like I was getting out of shape, but I knew I wasn't.
Dr. Davis, please share your thoughts about that video.
Yes, so I think he really just said it best, right? That, their perception about these products being safe, the perception about these products being used as a way to reduce stress. We hear that all the time. People say that they use tobacco because it helps as a stress reliever. But oftentimes what they don't realize is that that is just the addiction playing out. Right. It's just, you're creating that cycle in your brain of because smoking does release dopamine, it does make you feel good, but then you set up this addiction where then you have to have that cigarette again to produce the same effect. And now you're kind of down this rabbit hole of addiction. And that's, kind of the challenges of addressing addiction. So I think we have to do better, as he said, identifying, triggers for tobacco use, triggers for addressing stress, anxiety, depression, as he said, and supporting teens in that regard to help prevent them using alternative substances to help address that problem. That I think he said it best, with the perception that these things are safe and being introduced to them as a way to cope with stress and anxiety.
Absolutely. Absolutely. Thank you so much, Dr. Davis. Now let's answer a few more viewer questions. Here's one from Gerald in Ontario. He's asking us, the World Health Organization recently set a goal to support 100 million smokers around the globe in successfully quitting their addiction to smoking. What is your advice for anyone watching today who wants to quit using tobacco?
Absolutely. The first thing I would say is make a quit attempt. Just quit. Set a quit date and then make a quit attempt. Decide that you're going to quit as the best thing you can do for your health. And realize that the more quit attempts that you make, the more successful you will be at staying quit. We know that the research shows that oftentimes it takes people maybe 7 to 9 times to make that many quit attempts in order to eventually be successful. So just keep making the attempt. Talk to your doctor about medications. There are a lot of FDA approved medications that can certainly help to treat tobacco withdrawal and address the cravings while you are trying to quit. There are also many resources in your local area. One big resource are your state quit lines. They are equipped to be able to provide counseling and help you strategize about things that you can do to address your withdrawal while you're going through it, as well as some of those quit lines are also able to provide medications to help you safely get off of tobacco. And a lot of your health insurance companies do that as well. So I would say, just make the first step and decide to quit, and then set a quit date, and then just make an attempt to do that. Reach out to your doctor, your health organizations, the AHA, all that have resources to get you more information on how to do that successfully, whether it's through counseling and or medications. But yeah, I would recommend everyone just make the decision to quit.
I love that. Make the attempt and set the date. Love that. Great advice, Doctor. Lauren from New Orleans states, you direct the University of Pittsburgh Medical Center's Tobacco Treatment Service, and under your leadership, the UPMC has developed a model approach for supporting patients. Tell us about your approach to the health system, your approach that the health system is taking.
Absolutely. So we have a tobacco treatment service. It has two components. There's an inpatient component where we have certified tobacco treatment specialists who can be consulted, that will come and deliver counseling to patients at the bedside while they're in the hospital, as well as provide medication recommendations to their healthcare team to support them with tobacco withdrawal while they're in the hospital, and then help them to develop a plan to stay quit once they leave the hospital, and help connect them to resources that can further help support their efforts to remain quit once they're discharged. So we also have a outpatient component where we focus on our surgical subspecialties, where we have a telemedicine, telehealth approach, where after their initial consultation with the surgeon and they're getting ready for surgery, they are referred to us, and we help to work with them in the weeks before surgery to get them off of tobacco prior to their surgery, in order to improve their surgical outcomes and give them the best start at healing. And then we will follow them again in the hospital, and then follow them once they're discharged to continue to help support them in their smoking cessation efforts. So we have both an inpatient and outpatient program, as well as we also are involved in training all of our clinical staff with the keeping them up to date on all of the current treatment recommendations and guidelines, so that everyone in the hospital feels equipped to be able to address and support anyone who is using tobacco that are patients, and be able to help them successfully, push them more towards the pathway of quitting. So that is our approach.
Awesome approach, Doctor. Leanne in Hot Springs asks, why do you believe that it's important for us to achieve the tobacco end game?
I think because we have lost too many lives to tobacco. We lose 450,000 plus patients every year to the effect of tobacco. Now, to put that in perspective, I think prior to the COVID pandemic, I think people had a hard time appreciating what that meant. But after losing 600,000 people in a year and a half to COVID, right? I think we now understand losing 450,000 people, that's a big number, right? And we don't have to lose those people. We do not have to have those deaths due to tobacco. So I think anytime we can avoid a death, a premature death, is worth it. And that is why it is important for us to achieve the tobacco end game.
Absolutely. Our final question comes to us today from Raul, and Raul wants to know, what is your advice for someone who has a friend or a loved one who uses tobacco?
Yes. So I would say be supportive and encourage them to quit. Anytime you see them, just ask, hey, are you thinking about quitting? Have you thought about quitting? Anytime you can just ask people to think about it, get them thinking about it, support them in their effort if they are thinking about it, help them connect to resources if you can. But just sometimes just asking people, are you ready to quit? When you're ready, I'm here to support you. So I think encourage them to quit, be supportive in that process. And if you are able to link them to resources such as the Quit Line, the AHA, their doctor, their health plans, to provide resources to help them do that, I think that's the best way to go.
Dr. Davis, I'm so glad that you could join us today for this important discussion. That does it for our show today. But what an important topic. The tobacco endgame is such a critical statement and goal. I do hope that you and I can live long enough to experience the tobacco-free future. Is there anything else that you'd like to add today before leaving us, Dr. Davis?
Yes, that is, if you do use tobacco, I encourage you to make that decision today to quit. It is the best thing you can do for your health. At the American Heart Association, we are all about heart health, and it is the #1 risk factor for stroke and heart disease. And it is the #1 thing that we can do to prevent those things. So I would encourage you to think seriously about quitting. There are a lot of resources. We know we can get people to quit. There are very effective ways to do it. Just reach out to your doctor. Go with somebody if you need someone to go with you, but just make a quit attempt, because every life counts and we need you.
Yeah, absolutely. Make that attempt and set that date. Thank you again, Dr. Davis. That does it for our show. Always remember that you can find any of our previous shows by visiting the AHA's House Calls YouTube playlist. Just click on the name underneath the video. Thank you so much for tuning in. Next week, we're going to get physical and talk about managing blood pressure and cholesterol. Break out your leg warmers. Get ready. We'll see you then. Take care.
Learn more about House Calls, Real Docs, Real Talk. Submit your questions at heart.org/housecalls.